Good. All right.
Mhm.
So we did a project on procedures for management to encourage staff to meet national patient safety goals. My name's Christina, and my fellow group members are Deborah, Joanne, Melissa, and Justine. Next page. So patient safety is one of our main goals of every hospital. These patient safety goals are set by the Joint Commission. Management and nursing staff work very hard to keep the workplace and patients safe by following these guidelines. Evidence-based research is done in order to find ways to improve patient safety and outcomes to meet national patient safety goals. We utilize that research in our practice to create a better environment for our patients and staff. Next page, please. Nurse leaders serve a critical role in maintaining and implementing national safety goals. Nursing leaders achieve these through effective communication and collaboration with other healthcare providers, using evidence-based practice in implementation of national safety goals, and continually developing strategies to review the roles that best suit the institution, the staff, and the patients. Next.
The 2016 National Patient Safety Goals, as recommended by the Joint Commission, are identifying patients correctly. That means, using at least 2 identifiers, asking a patient their full name or date of birth, improving staff communication, using medicine safely. This includes labeling the medication, observing the 6 rights, or actually 10 rights now. Use alarm safely. This includes equipment like IV pumps and safety alarms such as the tab alarm or the bed alarms, preventing infection. Proper hand washing is a big prevention of infection. Identifying patient safety risks and prevent mistakes in surgery. Next slide.
How do nurse leaders implement national safety goals?
Okay, so how do nurse leaders implement national safety goals? First one would be effective communication and collaboration. The steps in achieving effective communication and collaboration with other healthcare providers are as listed. First one would be putting focus on behavioral change efforts in addition to more typical intellectual approaches. Awareness to differing human behavior aspects, awareness to contrasting workplace interactions. Second one would be building healthier communication skills. This is very important, especially for nurses. This translates into important abilities such as asking for, offering, and accepting help. Setting limits, saying no, and negotiating compromise. Respecting self and others, which includes also respectful listening. Practicing assertiveness for personal and professional growth and empowerment. Next slide.
Using evidence-based practice. There are 3 leadership strategies that foster evidence-based practice. Number 1, facilitating the incorporation of research into practice by addressing individual nurse concerns and being accessible to staff. Number 2 is creating a work environment that emphasizes best practices. And number 3 is affecting organizational policies in a way that fosters evidence-based practice.
Third one would be continuous strategic development. Leadership strategies to promote individual and organizational behavioral change. So it's important to note that building trust and healthy relationships are inherent in all, especially in the nursing field. First one would be nursing leaders should develop a plan with vision, commitment, and consensus building. And the plan should be developed from staff input. Messages communicated through newsletters, having meetings, postings, blogging, and word of mouth. Another way is to encourage staff to be part of a committee, other departments, or nursing management. Next slide. So another way that nursing leaders could do continuous strategic development would be incorporating training in practice. It's important to note that making sure that staff has training in basic skills, it's necessary for respectful listening and speaking up. So we offer training. One way would be offering training, which can be packaged as giving and receiving constructive feedback or communication skill building. Third one would be working with human resources to create opportunities to reward individuals, pairs, and team growth. Fourth would be coaching individuals who may be struggling with new skills or the changes being made. And fifth one would be role model the skills or the changes that are being made and encourage others to do the same. Next slide.
So the change theory is one way to monitor how we make changes in the work area. So the first step is to unfreeze. So be aware of the problem. Voicing out problem areas that need interventions to bring light to the issue is the first step in solving the problem. The second part is movement. So taking action to solve the problem. So we can formulate like unit-based teams and organize team meetings to create a plan and achievable steps to make the necessary change possible. The third step is refreezing. So to stabilize and maintain the change, to put the plan into action and continue to receive feedback on the effectiveness of the plan from nursing staff and other healthcare providers. So some of our supporting points is in quality and patient safety improvement programs such as SPI. This research suggests that managers and frontline may consider the same elements of the same program differently, and where there is a difference in opinion, managers are more likely to report a more positive outcome compared with their frontline counterparts. It is critical that the policy and regulatory communities expand their framing of the problem to help catalyze continued improvement in clinical performance and healthcare delivery. Supported by several studies, the promises of shared governance are important patient quality outcomes, high professional nurse satisfaction, the ability to recruit and retain bright and committed professional nurses, and energize and engage nursing staff. Also, leaders demonstrate support of a safe and effective and efficient work environment by encouraging staff to implement evidence-based practice, integrate clinical findings in daily practice, utilize computer-based clinical decision support systems, and define quality measures. Nursing leaders provide constructive feedback to the staff through effective communication. They understand that people grow and nurture at different paces and people have different needs. Through effective communication, they are able to eliminate barriers such as gender, age, experience, ethnicity, and sexuality. Key attributes of a clinical leader are expert clinical skills, patient focus, vision, stamina, innovation, dynamism, confidence, selflessness, assertiveness, and collaboration with other healthcare professionals.
And more supporting points, leaders demonstrate support of a safe and efficient work environment by encouraging staff to implement evidence-based practice, integrate clinical findings in daily practice, utilize computer-based clinical decision support systems, and define quality measures. Nursing leaders provide constructive feedback to the staff through effective communication. They understand that people grow and nurture at different paces and people have different needs. Oh, wait. I gotta change.
Oh, sorry.
Sorry about that. Anyway, more supporting points. A qualitative study conducted by Ott and Ross regarding shared governance of nurse managers and staff nurses revealed that nurse managers described their role as one of a facilitator who promoted growth, communication with staff for their input and ideas, and working with physicians collaboratively to decide what supports best practice and what is best for the patients. The hypothetical model findings supported the link between transformational leadership to nurse and patient outcomes through supportive practice environments, organizational citizenship behaviors, safety culture, and job satisfaction. Transformational leadership had a significant indirect effect on patient falls. Lieber and colleagues learned through their study regarding the effect of leadership on hand hygiene adherence that in one unit, adherence declined slightly from year 1 to year 4 after a multimodal intervention, but remained much higher than before intervention. And adherence dropped in the second unit after a loss of leadership. Strong leadership presence may improve hand hygiene adherence. Next slide, please.
So our proposed action item, therefore, is shared governance teams and meetings to improve safety and quality patient patient-centered care throughout all nursing spectrums, and also addressing the uncooperative and non-compliant staff that do not follow through with the proposed changes for quality patient care. Disciplining the staff is a major proposed action item that nurse leaders incorporate into their work in order to ensure a safe environment for all.
And the interview with the director of nursing, we chose to interview Mary Jean Pisco. She's a director of nursing at Fallbrook Skilled Nursing Facility. And to summarize the interview, she's utilizing the transformational leadership. And this type of leadership identifies the needed change and collaborates with the members of the group to reach the goal. The main issue at the facility is the constant change the employees experienced in the last year. Their main hospital, Fallbrook Hospital, closed down, and the facility was also threatened to be shut down. They had 4 different DONs and 1 new administrator in the last year. There were major pay cuts, and their staffing ratio was increased, and there was a decline in availability of supplies and resources, such as having access to doctors physically. Another issue the DON was concerned about was the lack of leadership from her charge nurses and dealing with veteran nurses who are so set in their old ways. It is important for her to reach out to her nursing staff individually before she can foster any changes to the facility. According to her, the only way she can implement her system is through mentoring her licensed nurses, LVNs and RNs, for them to be a mentor to the CNAs as well. Her ultimate goal is for the nurses in the facility to be self-sustaining in the future. She believes that once this is accomplished, the delivery of care would be phenomenal, and patient care will never be an issue if her staff feels valued and appreciated, mentored, and molded into the nurses she wants them to be. And our references on the next page. And the next one. And that's our presentation.